We are back at 8:12. Suicide, the 8th leading cause of death amongst all adults in the U.S. There are twice as many suicides as homicides. And this is even more disturbing. 4 out of 5 people who commit suicide are men. Maybe not so much disturbing as it is really interesting. I mean, I never realized that.
Yeah, well, it's very troubling, and this week marks National Suicide Prevention Week. And here to talk about this serious issue is Bay Area psychotherapist Dr. Courtenay. He's also known as the Men's Doc, and thank you so much for joining us.
It's my pleasure to be with you on this damp
yes.
Sunday morning.
Yes. Give us a sense of what you found in your research and in talking to patients as to why so many men commit suicide.
Well, you mentioned that number. I think it's important, too, to put this in context. In every hour of this morning's news program, 3 men will take their own lives. That's more than 70 U.S. men each day. It is really quite staggering.
Yeah.
Probably the biggest reason in terms of why men commit suicide is that men's depression is not getting treated. You know, there's a very strong connection between depression and suicide. But there's a myth in our society that men just don't get depressed. And that myth is so powerful that even trained mental health clinicians are less likely to correctly diagnose depression in men than in women. That increases their suicide rate. That myth also communicates to men that they shouldn't get depressed.
They shouldn't have emotional feelings.
Exactly. And so they don't.
So tell us how those signs look different than what women would expect.
Well, it's a great question, Isabel, because they're not always so easy to spot in men. You know, when we think of a depressed person, we usually picture in our mind somebody sad and crying, but picture instead a guy who's working 60 hours a week, kind of irritable all the time, slipping out of his office to have an affair, drinking with his buddies after work every night, and then speeding home to his wife. Now, that's not what we characteristically think of as depression, but those are some of the signs of men's depression, which can look very different. So increased stress and irritability, anger and conflict with others, withdrawing from others, or working constantly, increased drinking and impulsiveness and risk-taking. Those are all the signs. Now, men do experience and can experience some of the classic signs of depression, like a sad mood and sense of worthlessness or loss of interest in hobbies or sex. But because men are more likely to hide depression, it's important to look for anything that's out of the ordinary for a man.
It would also seem to me that, generally speaking, men have less of a tendency to reach out for help.
That's absolutely right. I mean, they're far less likely to get help for depression. But unfortunately, when they do get help, they get not diagnosed, they don't get treated as well, and so then their depression gets worse.
Compounds the problem, doesn't it?
It does compound the problem, exactly.
Let's step back because you said hide depression. So oftentimes they won't admit to themselves, first of all.
Yes.
And that requires the first step towards going for help.
Well, that's right. And Marty, I'm sure you know what this is like. You know, as for men, you know, after a lifelong, you know, training in how to be a man, we oftentimes don't express sadness or cry when we're feeling down. And for many men, it's just shameful to express any feelings that might reveal weakness. Exactly. Yeah. So what happens is, in fact, what we see is men who struggle more with that, or who believe those things and have more kind of traditional or rigid ideas about gender roles, are actually at greater risk for depression. And it's compounded again because they're less likely to seek help for their depression.
I would think that during these tough economic times, you're seeing an increase in men who are feeling depressed and are also driven to suicide, or at least thinking about suicide.
Well, we've all heard the headlines of men in economic stress who've committed suicide in the last year. And because they do represent, you know, what, more than 4 out of 5 people who are unemployed right now, I think we are going to see, after we look at this year, we are going to probably see a spike in suicide rates.
So there are no easy answers, obviously, but what would you leave folks with the message here today, particularly men?
Well, especially in terms of suicide, it's so important to take it very seriously, whether it's yourself or someone else. You know, most people who committed suicide actually let someone else know that they were thinking about it beforehand. So ask a man, have you thought about hurting yourself? And then if there is an immediate risk or danger of suicide, don't leave that man alone, and make sure he gets the help he needs. So make sure he calls 1-800-SUICIDE or 911, or gets to local emergency room. And if it's possible, you can also get rid of any potential tools for suicide, like guns and medication.
So a woman's got to be paying attention here as well. And if the man refuses, even though she thinks he really needs help, is there a way to do intervention or call or do something?
Well, again, probably in that case, make sure that, again, those potential tools of suicide are not accessible.
And that you don't leave the person's side.
And that you don't leave the person's side, you get help. And then if the risk is not as imminent, then probably the most important thing is just helping him to get support. So through friends and family, to let others know about it. Through the community, sometimes a priest or a rabbi can be a great source of support, and of course a licensed mental health clinician.
Yeah, there are so many organizations out there now that offer this help. All we have to do is reach out.
And through mensdoc.com, as well as mensdepression.com?
Yes, men's-depression.
Depression. Okay.
Dr. Will Courtenay, thanks so much for joining us.
Oh, it's been a pleasure.
Very nice, thank you.